particularly during this period of COVID-19 pandemic. Seasonal variations, including extreme temperatures of both hot and cold, have been associated with increased morbidity and mortality among people with respiratory conditions such as chronic obstructive pulmonary disease or COPD. Cold seasons like winter can impact lung infections, lung functions, and even worsen the risk of infections. The risk of tuberculosis transmission appears to be the greatest during the cold months, particularly in overcrowded and poorly ventilated settings. There are several possible reasons as to why infections of tuberculosis tend to rise during this cold season. This is brought about by the lack of vitamin D, indoor activities, seasonal changes in immune function, and patient or healthcare system delays in the diagnosis and treatment of tuberculosis. During this cold season, the country has continued to witness an upsurge in COVID-19 cases, and being an infectious airborne condition, there are concerns of its rise during this period. This should be a clear wake-up call to all those with respiratory illnesses to take extra care, because it is in this period that the conditions can suddenly worsen. So given that in a cold season already those with respiratory conditions are more susceptible to infection, and if you overlay upon that the ongoing COVID pandemic, you can see the danger that this can present to those with respiratory illnesses. Most people will tend to congregate in closed spaces in a bid to avoid the cold, while others will light fires in their houses to keep warm, particularly patients with asthma, COPD, and allergic rhinitis. Whereas it is important to keep warm, smoke can as well trigger allergic and asthmatic attacks, worsening the situations of persons suffering from those conditions. On the other hand, a poorly ventilated and confined room is a perfect setting for the spread of respiratory infections such as influenza, tuberculosis, and even COVID-19. Because of inadequate space for social distancing, if two or more people are living together. Ladies and gentlemen, I would like to appeal to our people to take extra precautions during this cold season by ensuring that they put in place certain measures that will ensure that they are not exposed to infections. This includes dressing warmly to avoid any triggers, keeping social distance to avoid respiratory infections, wearing a mask, which is very critical, especially in reducing transmission of infected droplets, keeping well hydrated by drinking lots of water and fluids, carrying out physical exercise. For those with underlying conditions, it is important to adhere to their prescribed medication, and we cannot overemphasize the need for hands and body hygiene. Seeking medical advice from our healthcare facilities in the event of any illness, including experiencing difficulty in breathing. We realize that during the cold season we also have a number of the common colds and flus, and these conditions also share the same symptoms with COVID-19. So it is good to be alert and vigilant, if you you see any of these symptoms, please seek medical advice. For those with chronic illness, make sure adequate supply of medication is available to avoid running out of this medication. Turning now to the COVID-19 statistics for the last 24 hours. Today we report 544 people who have tested positive after testing 2,653 samples. This now brings to 22,597 the number of positive cases. And our cumulative number of tests that we have conducted so far stand at 318,376. From the 544 cases we are reporting today, 499 are Kenyans, while 45 are foreigners. 315 are male, 229 are female. The youngest case is a 1-year-old infant. The oldest is an 84-year-old. The distribution of cases by counties in descending order is Nairobi, 412 cases, Kiambu, 27, Machakos, 17, Kajiado, 17, Garissa, 16, Uasin Gishu, 14, Mombasa, 9, Nakuru, 8, Nyeri, 5, Narok, 5, Makueni, 4, Laikipia, 2, Muranga, 1, Kilifi, 1, Busia, 1, Embu, 1, Bungoma, Kisii, Kwale, and Meru, also 1 each. For the top 5 or so counties, these numbers, the cases are distributed in sub-counties as follows. Nairobi's 412 cases come from Langata, 150, Westlands, 48, Dagoretti, 43, Embakasi East, 37, Makadara, 36, Embakasi South, 35, Kasarani, 25, Kamkunji, 20, Roysambu, 20, Embakasi West, 18, Embakasi Central, 16, Kibra, 16, Starehe, 16, Embakasi North, 9, Mathare, 9, Ruaraka, 8, and Dagoretti South, 6. Kiambu's 27 cases come from Ruiru, 8, Kiamba, 6, Kikuyu, 6, Kiambu Town, 4, Kabete, Lari, and Limuru, 1 each. Machakos' 17 cases are in Athi River, all of them in Athi River, and Kajiado's 17 cases come from Kajiado North, 14, Kajiado East, 3. In Garissa, the 16 cases are in Garissa Town, while in Uasin Gishu, the 14 cases are from Tarbo, 5, Ainabkoi, 2, Kapseret, 2, Moiben, 2, Soy, 2, and Keses, 1. Mombasa's numbers have come down. The 9 cases in Mombasa came from Mvita, 5, Nyali, 3, Kisauni, 1. Nakuru's 8 cases are from Nakuru East, 4, Rongai, 2, Gilgil, 1, and Nakuru West, 1. The rest of the counties and sub-county distribution is in the document as you will receive it. On a more positive note, 263 patients have recovered from the disease. From this number, 176 are from the home-based care program, while 87 have been discharged from various hospitals, bringing the total number of recoveries to 8,740. I want to really thank our healthcare workers for the good work they're rendering to the country. Unfortunately, we have lost 13 patients from the disease, Earlier on, we mentioned to you that one of these that we lost, and the youngest among those whom we lost, is the 32-year-old nurse. Amongst these 13 that we lost, 10 of them had underlying, some of them multiple underlying conditions. It's only 3 of them that did not have any underlying condition. My sincere condolences to the families and friends of those who have lost their loved ones. I thank you.
I'm Brian Otieno from KTN News. Last week, the CS Kagwe banned traditional circumcision ceremonies, and we've seen them going on. Are you doing anything about that? And also, in recent days, we've seen, we've recorded the foreigners testing positive, a high number of foreigners, today 45. Are these foreigners living in the country, or are they those flying into the country? And what does it mean now that we've opened up our airspace? And also, I'd like you to address a concern from a viewer who fears that now Kenyans will start abusing vitamin supplements.
Elfas Legat for Citizen TV, and I have 2 questions. One is about nurses and critical caregivers. There is concerns about 2 hours ago raised by nurses that in Kisumu, Taita Taveta, and Vihiga, and some other counties that I may not have documented, there is evident sub-bar or rather low-quality PPEs that these critical caregivers are getting, and also that there are counties that have not paid their nurses, and these are people you've sent to the front line in battling COVID-19. And I know that health being a devolved function, but now this is a nationwide concern. How do you intend on responding to this particular issue raised by nurses? And number 2 is about Tanzania. Tanzania being marked as a safe country. Of course, we have talked to some officials from the Ministry of Transport, and they said that this particular issue is a public health, which in effect makes it a prerogative of Ministry of Health. Is Tanzania officially made a safe? Has it been marked as safe? Thank you.
My name is Mutanu from the Daily Nation. I have 2 questions. One is about the nurses. We have received information that there are hospitals in Nairobi which have been closed. So can you kindly confirm or refute the claims? And then the other, okay, they have been closed because of some healthcare workers have turned out to be positive, and they had to close. Then the other question is about employment of ICU nurses. We understand that there was some recruitment which was ongoing of 300 ICU nurses. I don't know, where is the process? Where are we? Thank you.
Okay, thank you. See what I can answer for you. The others, perhaps my colleagues will be able to respond to some of these questions as well. Brian Otieno, the traditional circumcision, I think the ministry's position and regulations in place are very clear that we need to be able to avoid any gatherings or situations that will promote spread of the virus. That's very clear. And anything that goes against that is flouting that regulation. I also read in today's paper that circumcision ceremonies were being conducted in parts of the country. I think we will leave that to the relevant agencies that will follow up to determine whether these procedures were flouted. But clearly, it is not something that the ministry would condone or would want to ignore, because the messages that we have been passing out here, the measures that we have put in place, are all intended to protect us from spread of this virus. Therefore, any amongst us, any groups who in their desire to fulfill what they want to do, flout these laws, will be going against the good of the country and the concerns of public health and preservation of health. You also queried about the foreigners that we report here. Now, let me clarify that the foreigners we report, when we say so many were foreigners, are foreigners who are resident in the country. So these are people who live with us, they are residents, and they turn out to be positive. They are not travelers who are coming in. If you know that it was only on the 1st that the international airspace was opened, and protocols have been put in place to try to make sure that those coming into the country do not pose any risk of spreading the virus. Hence the necessity of a COVID-free 19 certificate 96 hours before boarding the plane. That is one of the measures that will ensure that the people who are coming in do not pose any risk. So to answer your question simply, those foreigners live amongst us and they are residents. Elfas Lagat, your concern on nurses is something that, of course, we place a very, very high premium on our healthcare workers, because without them we may not have a response to this pandemic. And it is upon us to make sure that we take all the necessary action to allow them to work in an environment where they feel safe and protected from this highly infectious virus. Hence, the effort that government has put into providing PPEs to all healthcare workers and all frontline workers, for that matter, who stand the risk of being infected by this virus. The PPEs that are being provided and procured are PPEs that have been subjected to various tests and standards, and we do know that at least what the government is providing are PPEs that have met the standards that have been set, the CAPs, and have been tested by CAPs and other institutions, that they are of the right quality to ensure protection of those who are using PPEs. There could be PPEs that might be substandard, being provided through other sources. We are very vigilant in making sure that the products that are used there, any health products and technologies that are out in use there, meet our requirements, our regulatory requirements, and our standards, so that they are safe and protect those who are using it. Tanzania being marked as a safe country. I think if you look at the case of Tanzania, we never stopped Tanzanians from coming into the country, because we never really closed the border for cargo and truck drivers, if you remember. And you remember that we have spent quite a lot of time in the spirit of East African cooperation to work out mechanisms by which that flow of traffic can still happen across the borders. And we agreed, it was a consensus, that this would be done on the basis of a reciprocal acceptance of a testing certificate, COVID-19 testing certificate. And that is being done and it is being observed, and we have Tanzanians who are always crossing over the border as Tanzanians bringing in cargo into this country. Now, when it comes to the airspace, it is no different, because, again, they will be subjected to the provision of a COVID-19 certificate. So all air travelers who are coming into the country are subjected to provide a COVID-19 certificate. In addition to that, of course, then there are certain restrictions, and maybe that is where you're coming from, that there would be restrictions on who then goes into quarantine and who it does not go into quarantine, and that is based on the risk level of every country as it is assessed on a daily basis from the reports that are obtained from the World Health Organization. And that is an evolving picture that we shall see. I'm sure as time moves, we will see that list being revised on a regular basis. The Daily Nation, nurse hospitals that have been closed. I think I will defer that question to either Ombacho or Dr. Kuria, because I'm not aware of hospitals that are closed. And if any hospital or facility has been closed, it would probably be because of safety concerns to try to prevent the spread of COVID-19, if indeed there was some cases among the healthcare workers. But I think these two gentlemen, one of them or both of them, will respond to that. About the HR recruitment for ICU nurses, again, I think I will defer that to Ombacho, who may have a response to that. Ombacho.
Thank you, Waziri. We can only agree with you that we don't have any information of any health facility which has closed because of health workers. So, and unless you have got one that you want us to, but we are not aware as a ministry. And in terms of employment, as you are aware, the ministry is doing a lot of recruitment around capacity building in quite a number of issues. And this is an ongoing issue. And as you are aware, we have only started a new financial year, and we will keep updating you on where we are. But you realize this is an emergency. It will be fast-tracked. Thank you.
Okay. Anything to add? Okay, Alpha Salagat, did you ask about counties that have not paid their staff? I'm reminded. I can see you on the phone, so I will pass over that. I said, did you ask a question about counties that have not paid their staff? Okay, I don't think I can answer that question. I think that would be a question we would have to defer to the Council of Governors to be able to inform us on that. But as you know, the counties are, we are in the middle, we have just rolled over into a new financial year. You know what is going on right now, the meetings in the Senate and all of that in terms of allocation of their resources. So there may be some difficulties in meeting financial obligations, I think, as this process unfolds, and hopefully it will be resolved in good time so that those resources are available to the counties to meet their obligations. Thank you.
Pata smartphone mpya kuanzia 20 bob daily pekee ukilipa mdogo mdogo. Weka down payment ya 1000. Lipa kuanzia 20 bob daily kwa miezi 9. Piga star 544 hash kuona kama unafaulu kupata 4G Neon Ray Pro. Si hapo Safaricom ni yako kabisa.
I expected more from you, David.
Well, ma'am, I'm not disrespecting you.
I devoted myself looking out for you and your children, and do I get any gratitude? Of course not. She always gets the credit.
Marta worked hard to earn their love and affection. It's hard work, but you may want to try it.
That woman is very dangerous. And she's doing something to entrap my son-in-law. So I don't care how you do it, but I want every moment of that scheming woman's life to become a nightmare.
What can I do for you?
For me? Nothing really. I just came to inform you that I don't approve of someone like you. Even if you keep flirting with my father, never will you replace my mother.
Along came love.
in association with Blue Band Peanut Butter.